Hello, and thank you all for joining us today as we debate the topic of collaboration among professionals. Our debate team consists of two pro debaters, Elizabeth and myself, Samantha, and two con debaters, Kayla and Reagan. I'm going to pass it over to Elizabeth, who is going to provide a brief overview of our topic.
Thank you, Samantha. So, we will be talking about collaboration among professionals today. What is this? Collaboration among professionals is often seen as critical for effective treatment within an autism diagnosis, etc., but it does not come without its challenges. Why should professionals collaborate? Why should professionals not collaborate? What are the pros and cons? We will be discussing the pros and cons among professional collaboration. And to kick it off, we're going to start with the pro of collaboration among professionals. As we know, autism spectrum disorder among children is common and affects every individual differently. To address the challenges that come with this diagnosis, there needs to be a team of healthcare professionals working together with the individuals and their families, the stakeholders, the third parties. They all need to work together to get this intensive, effective treatment. Studies have shown that interprofessional collaboration is beneficial in the development of a child, and there are different domains that can be worked on with collaboration as the main focus. The goal of ABA, Applied Behavioral Analysis, is to teach clients to be as independent as possible. We also follow the ABA core principles, which are benefit others, treat others with compassion, dignity and respect, behave with integrity, and ensure your own competence. The more intensive a treatment is, the better outcome that we're going to get in the end. Again, longevity and generalization of these topics is what we want. The more intensive a treatment is, the better the outcomes you get. An article by Gizwitsky et al. Says the benefits of collaboration stem from the infusion of expertise that exceed that available within only one discipline. This just goes to show having, say, a speech therapist working with a registered behavioral technician will improve the communication skills among the individual.
Hi, my name is Kayla, and I'm going to talk about some of the challenges and potential downsides of professional collaboration. While collaboration among professionals is often praised for its benefits, it's not as always as smooth or effective as it sounds. There are several common issues we need to consider, including communication barriers, role confusion, time efficiencies, and accountability concerns. We can go ahead and start with the communication barriers. When professionals from different fields come together, their unique perspectives, terminology, and approaches can sometimes make communication tricky. For instance, an ABA therapist might focus on behavior strategies, while a speech therapist is more concerned with communication goals. If they're not on the same page, this can lead to conflicting strategies and missed opportunities for clients. Research shows that interdisciplinary teams often deal with challenges like differing terminology and priorities, which can make teamwork harder and leave everyone feeling frustrated. Another big challenge is role confusion or even overlap. When it's unclear who's responsible for what, things can get messy pretty fast. Take an ABA therapist and a special education teacher, for example. Both might be working on improving a child's classroom behavior, but the ABA therapist could develop a behavioral plan with reinforcement for like a child staying seated, while the teacher uses their own classroom management strategies to address the same issue. And if they're not communicating and coordinating, their efforts could clash together, like using different reinforcement systems, which might confuse the child and slow progress. This kind of disorganization makes collaboration less effective and can even impact the success of the intervention. Now we could go ahead and talk about time. Collaboration does take time, sometimes more time than we even realize. Scheduling meetings, sharing updates, coordinating plans, this can all add up and otherwise be spent working directly with the clients. For example, getting everyone on the same page for a team meeting often means juggling everybody's schedules, which can especially be tough in smaller practices with limited staff. And when time and resources are stretched, then this effort can feel more like a burden than a benefit. Finally, last, there's accountability. When multiple professionals are involved, it's not always clear who's responsible for specific outcomes. For example, if a client isn't making progress, team members might assume someone else is handling the issue, and important adjustments might slip through the cracks. Without clearly defined roles and expectations, accountability can get lost, which ultimately affects the quality of the care the client receives.
The BACB Ethics Code 2.10 discusses that it is in the best interest of the client and stakeholders for behavior analysts to collaborate with colleagues from their own discipline and other professions. Collaborating with other professions allows for the services to be more personalized as well as being more intensive for the client. This produces a better outcome of learning and progress within the client. Yes, there is the concern that other disciplines, such as speech therapists and occupational therapists, have different methods of teaching these skills that don't align with ABA. However, consulting with them prior to a session to establish the boundaries and work together on how the session will go can be beneficial for both the client and everyone else involved. BACB Ethics Code 3.06, consulting with other providers, discusses the importance of consulting with others. While complying with the appropriate consent and applicable laws, consulting with other disciplines is in the best interest of the clients. Bowman has produced an article, and I'm going to reference the Standard Adherence Self-Assessment Checklist, which team members should practice using within their boundaries and scope of competence. This checklist, as seen right here, is a checklist for collaborating professionals to determine if transdisciplinary practice is being used to maximize the delivery of effective and efficient treatment. While still adhering to this checklist and the ethics code provided, professionals can determine if it is in the best interest of the client to be collaborating with other professionals. The different sections of this self-assessment checklist include collaborative communication, distinguished roles in collaboration, role of the organization, client care, which is extremely important when determining the ethics behind this, conflict resolution, joint partnership, evidence-based practice, and collaborative culture. All of these are very important to take into consideration when assessing if collaboration will be beneficial for a client as well as the therapist. And in the study that was done by Bowman, it has proved to be very effective.
In ABA therapy, collaboration is crucial, but as the size of the team grows, so does the complexity of keeping everyone on the same page. Adding more team members can sometimes lead to misunderstandings, inconsistent strategies, and a shift away from focusing on the client's individual needs. For example, if a child with autism is working with an ABA therapist, a speech therapist, an occupational therapist, and a school counselor, poor communication between team members can result in conflicting strategies. This kind of misalignment might confuse the child and even unintentionally reinforce maladaptive behaviors, causing setbacks instead of progress. Larger teams also make it more likely for goals to conflict, which can hurt the effectiveness of the treatment. Even though everyone shares the same goal, helping the client, they might have different ideas about how to get there. For instance, an ABA therapist might focus on reducing challenging behaviors while a speech therapist is more focused on a language development. If these goals aren't coordinated, one intervention might interfere with another, leaving the child feeling overwhelmed or even confused. These conflicts often come from personal biases, differences in training, or unique approaches to care. Without a cohesive team, the client could end up with interventions that work against each other rather than together, making the treatments less effective. A core part of ABA therapy is tailoring interventions to meet the client's specific needs. But with a bigger team, there's a risk of those individuals' needs getting overlooked. Team members may unintentionally focus on their own areas of expertise, making it harder to create a truly personalized approach. For example, if a child struggles with sensory processing, but the team prioritizes behavioral goals without addressing sensory needs, the child could end up feeling overwhelmed, which undermines progress. As more voices join the team, there's often a tendency to lean on broad, one-size-fits-all strategies. While these might seem more efficient, they don't always address the child's unique preferences or challenges. The bigger the team, the harder it becomes to keep the therapy fully client-centered, which can limit its overall effectiveness.
Okay, so as stated by Elizabeth, there are multiple professions and disciplines that apply to the skill deficits seen in individuals with autism spectrum disorder. So, collaboration among these individuals is imperative to a well-rounded treatment program for an individual. In the field of applied behavior analysis, our loyalty and responsibility is to the client. As it states in our Code of Ethics 3.01, behavior analysts act in the best interest of clients, taking appropriate steps to support clients' rights, maximize benefits, and do no harm. As cited in Bowman et al. 2021, the Kelly and Tankini 2013 article wrote that multidisciplinary collaborations are more preferred by clients, increase treatment integrity, and result in better maintenance of acquired skills. As behavior analysts, it is our duty to ensure the skills that we are teaching maintain and become generalized. When multiple disciplines work together and are actively communicating, this allows for the skills being taught throughout multiple disciplines to be generalized amongst different therapists and locations. This provides a more cohesive program and lifestyle for the individual with autism and their families. When the team of professionals are in collaboration with one another, it simplifies the interventions for the families. And the caregivers do not need to worry about listening to one discipline over another. Rather, it's a team effort and everyone's focus is on the child rather than their own individual programming. Captured in the Bowman et al. 2021 article is this visual shown on the slide referencing the scale of professional autonomy of individuals working on their own through cross-disciplinary interdependence. Within a transdisciplinary approach, roles are blended together, their expertise is intertwined, and each treatment program is built together. This allows the treatment team to share an integrated perspective and generate innovative yet pragmatic solutions to socially significant issues. And that is cited by Bowman et al. 2021. This is the most effective approach to utilize for our clients. Collaboration is a skill that is not always taught, but it is vital in the field of applied behavior analysis and imperative to the treatment of the individuals that we serve. Within our Code of Ethics, 2.10 states, behavior analysts collaborate with colleagues for their own and other profession from their own and other professions in the best interest of clients and stakeholders. Behavior analysts address conflicts by compromising when possible and always prioritizing the best interest of the client. As spoken about by Elizabeth earlier, and the use of standards adherence self-assessment checklist, using resources such as these can aid in putting biases aside and opening our minds to other viewpoints.
While Samantha does make some valid points, it's also important to consider that while collaboration can provide holistic care, it also raises significant ethical concerns, especially when professionals do not adhere to the same evidence-based practices. Behavior analysts are ethically bound by Ethics Code 2.01 to use scientifically supported interventions. Ethics Code 2.01 states, that behavior analysts prioritize client rights and needs in services delivery. They provide services that are conceptually consistent with behavioral principles based on scientific evidence and designed to maximize desired outcomes for and protect all clients, stakeholders, supervisees, trainees, and research participants from harm. Collaborating with professionals who don't follow these standards can create conflicts, as ABA is data-driven and highly structured. Introducing methods lacking scientific validation compromises treatment fidelity and undermines care effectiveness, violating ethical principles. Ethics Code 2.01 also requires individualized evidence-based practices. Collaboration across disciplines might introduce fragmented approaches that compromise this. Miscommunication or inconsistent strategies can confuse the client and hinder skill generalization, violating the ethical standard of timely individualized treatment. Additionally, coordinating care between professionals with different approaches can delay or distort treatment, compromising client progress. Delays in a cohesive treatment plan contradict the ethical responsibility to deliver timely and effective services. While Elizabeth and Samantha argue that collaboration improves outcomes, the client's best interests are best served when treatment is scientifically grounded and consistently applied. The Ethics Code stresses the importance of competence in interventions, requiring careful consideration of whether collaboration genuinely benefits the client or risks treatment integrity.
Collaboration with disciplines other than our own can sometimes prove difficult. However, for behavior analysts to adhere to one of our core principles of benefiting others as well as comply with our Code of Ethics 2.10, it is necessary to at least attempt collaboration. Research shows that when differing disciplines work cohesively, it benefits the client to the point that they prefer the team working together. It is our role as behavior analysts to consult with other providers. The individuals we serve most likely have comorbidities and deficits in multiple areas that require treatment that is not all in our scope of competence. And we must practice within our scope of competence and refer to other disciplines to treat the whole individual. Like if a child is sensory seeking, we need to seek assistance from an occupational therapist. And if a child cannot sit in a chair properly, we may need to have assistance from a physical therapist. If we don't understand how to use the AAC device that an individual has, we need assistance from a speech language pathologist. We cannot do everything on our own to best serve these individuals, proving again how vital collaboration is. So we must use resources like the Standards Adherence Self-Assessment Checklist. We must open our minds to other viewpoints, all while complying with our own ethical code and using evidence-based practices.
While larger teams in ABA therapy can complicate coordination, it leading to conflicting strategies and goals, which may confuse the client and hinder progress. With more professionals involved, there's a risk of losing focus on the client's individual needs, making it difficult to maintain a truly client-centered approach and reducing the effectiveness of therapy.
These last two slides depict the references that we have used to put together our collaboration among professionals presentation today. We do think that this topic is very important and that more research can be done by the other students in our class to understand the pros and cons of collaboration among professionals. Thank you.